we partner with public health to be just a public space where people can access Narcan. And I think at first we were wondering, like, well, will this actually get uptake? And I think in the first couple of months we had over 2,000 units picked up, and I believe over 10,000 in the first year.
Yeah.
And I think that probably has a lot to do with it's a place that people can go that doesn't have a stigma around it.
Exactly. Yeah.
You're not having to go to a substance abuse space or some space that's specifically about health. It's
Right.
just a public space that removes some of the stigma.
Yeah.
And I think that's what I attribute the just incredible uptake and use around that. And then also, I know we've been working with the Department of Public Health on these vending units that really connect people who are unhoused with resources that are just common needs, like socks,
Right.
feminine hygiene products, Narcan access. And again, when we got some of the preliminary data back and we looked at, I believe there's 6 units across the city. And we looked at the 2 most in use, high demand spaces.
Yeah.
They were in a library, which I thought, well, the Department of Family and Support Services, maybe that'll be a little bit more in demand there.
Right.
But it was the public library's vending units.
Yeah,
and
fascinating.
so I think when you look at that program and the high take-up of Narcan access, and then even the supplemental income, the Resilient Chicago pilot, you really see how a lot of people who are in need are in our spaces.